Hello, everyone. Once again, this is Dr. Deborah Ichadala, Dr. Red. So it's October and it's our breast cancer awareness month. And we're going to be talking and discussing on breast cancer this beautiful morning. So let's dive right into it. Breast cancer is a very important topic. Cancer in general is a very important topic, but it's something that we don't get to discuss a lot in Nigeria. We don't discuss a lot of things in Nigeria, actually, to be honest, but breast cancer is one topic that we don't discuss a lot in Nigeria. And it affects mostly women, but it also affects men. It also affects men. So we're going to be talking about it. We're going to be talking about breast cancer. Hi, Destiny, and welcome to our first live this morning. So let's talk about it. What's the first thing we're going to be discussing is every October, for example, we see pink ribbons everywhere. We see women putting up pink ribbons, talking about sharing their story, talking about how it affected their families and how it affected them. But most times we don't get to hear from those women or understand how breast cancer happens. So, for example, in Nigeria, breast cancer is the most common form of cancer in Nigeria. And according to research, we have over 50% of women that are diagnosed with breast cancer. Around that number presents within the third to fourth stage of breast cancer. That means that it has actually spread to other parts of the body. It has affected other organs before they actually present to the hospital. Most times when women notice lump, for example, on their breast, like a swelling or something, they don't really take it serious. They might just ignore it, especially if it's not growing in size, for example. And one thing about breast cancer, it can move from 0 to 100 in like a few days. It can progress actually rapidly, breast cancer. Number one, because of the number of vessels around the breast, because of the tissues around the breast, and because of where it is located. It can actually deteriorate or get worse within a very short period of time. So it is very, very important to be aware of that and to do early detection. If you notice anything, just get it done. Just get yourself checked. When was the last time you had a self breast examination? I can tell you a lot of women have never had self breast examination before. So it's very important to do that. Interestingly, I can remember years ago, the first time I detected some form of lump in my breast, if I'm going to share the story, was in 2015. 2015. I was just whenever my medical school around then. So I was writing my license exam. So we're doing these tests, like we're trying to practice, doing like some practice, because normally you do these practicals during the exam. So we're doing this practice amongst ourselves. We're trying to do palpitation and percussion and so on and so forth. They're like, oh, okay, let's even do breast examination. Let's just practice how to do it so that when we go for the exam, in case we're do breast examination, for example, we would know what to do. So that's how we did the examination for everybody. Got to my turn. I'm like, okay, it's my turn. Do practice on me. So that's how they were doing the practicing, and I could feel like something moving. And the doctor then, that's my friend, she was my colleague, she was my classmate. She could also feel something moving then. And that was the first time I detected I had breast lump that I've had there, I'm sure probably even for years or even months, and I was not aware. That's because even me, I don't really do, before now, I don't do self breast examination regularly. So you can imagine the number of millions of women out there that don't even do self breast examination. We just stumbled on it accidentally, and I was able to detect that early on. And yes, I was able to do a minor procedure to actually get that actually removed. That's how important self-breast examination is. Self-breast examination can save women, even men, a lot of time. It's one of the first tests to do, even before the breast scans or mammogram and the rest. One of the first tests to do, because you can do it every day. You can do it at the convenience of your home. You can get your friends or your sister or whoever to help you check and do that test. And it is very, 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 very easy to do. It's just to rub around it and feel for, and you will know when there is an abnormal tissue there, when there is a lump there, you would feel it, because it will be separate or detached from the regular normal breast tissue. So it is very, very important to do self-breast examination. I feel like if there's one thing that we need to take out from here, is self-breast examination. If you have any question or comment, please just drop it in the comment section. I will definitely read it. So what even causes breast cancer? So breast cancer just simply means an abnormal cell that is growing in the breast. You understand? Your normal cell, then a normal cell growing out of it that would form either a lump or a mass. And these cells can spread to other parts of the body, like I mentioned before. So that is breast cancer. So that's the best way to actually explain breast cancer. And some of the risk factors or things that can cause breast cancer: number one, family of breast cancer or any other form of cancer. Women that have prolonged in age from 35 and above, they are at risk of coming down with that. The fact that you're a woman self, you are at risk. Men also at risk. Not common for men, but it is possible. Hormonal changes or prolonged estrogen exposure. So that's the reason why most times women that have given birth, had multiple deliveries or multiple pregnancy, they are at risk of actually having breast cancer. Then lifestyles, poor lifestyles like smoking, excessive alcohol intake, obesity, lack of exercise can actually cause breast cancer. Another common thing that actually a risk factor now, which is very common, that I have seen, most women that I've spoken to, I had the opportunity of speaking to a woman last year during this time for the breast cancer awareness, and she was sharing her story because she's a breast cancer survivor. And she was sharing that she doesn't have a family history of breast cancer. She does not smoke. She does not take alcohol. She had multiple, she had like 2 children. She exclusively breastfed, which is one way to actually reduce the risk of breast cancer. She did all that, but she came down with breast cancer. What did she notice? One of the things that is very common now was the fact that she was consuming a lot of overly processed food. One, she wasn't taking care of her health. So she was eating a lot of overly processed food. That's one of the most common cause of cancer now. Things that we ingest, things that we consume. So she noticed that a lot of those she was consuming a lot of canned, she was consuming a lot of canned produced. She was consuming a lot of food from cans, from sachets, and so on and so forth. She wasn't buying like really natural, organic, produced food. And she said one of the things that helped her to even be able to beat cancer was the fact that she changed her diet. And that's one of the things I'm mentioning now. She actually changed her diet completely. Like, she stopped buying those sachets, whatever. Sachet paste, sachet whatever it is, overly processed, overly processed food, or food that contains high level of chemicals. And she started making her own paste by herself. She started growing, even she went as far as growing her own produce herself. And when she started doing that, started consuming healthy food, she noticed by herself, and this is a story that she shared with me. She noticed by herself that the lump and all that started getting strength, started getting healthier and stronger, started gaining more vitality to her body. And because she tried chemotherapy didn't work. She tried radiotherapy, that didn't work. They even did surgery for one of the breasts, but it was spreading to the second one. So she knew that she had to do something about it. So that's one major risk factor that people don't tend to talk about. what we consume, what we eat every day. And we in the world, for example, we consume a lot of overly processed food. I was listening to the radio one time, and then they were talking about sachet tomato paste. I'm going to use that as the case study for this life. Talking about sachet tomato paste, and people were doing a research in Nigeria here, and they found out that the paste that we are buying, not all of them, some of them, they had just only, I think, 10% tomatoes. And the 90% were just preservative, additives, coloring, and so many other chemicals. So it means that the supposedly natural tomato paste supposed to be having from those sachets was just 10%. There were some that were 5%. There were some that were 8%. There were some that were 4%. There was one that was 2%. Only 2% tomatoes inside, and the rest were chemicals. I don't have to start mentioning names on this live. That's not the idea of this live, but it's just to create awareness of the things that we tend to consume every single day. They cause a lot of harms. It may not be breast cancer, for example. It may be any other form of cancer. There are a lot of people that are coming down with different form of cancer right now, especially in Nigeria, and it's as a result of what they consume. So I'm really stressing on this matter so that we would have an idea of what we are consuming. And before you consume anything or eat anything, check the labeling. Because now the NAFDAC, for example, requires most of these companies, production companies that produce these things, to put the exact content. Some of them may lie, but some actually put the exact content. But just that some of us, we don't tend to read. So it is important to read what we consume. And if we have the opportunity to buy organic food, get them, purchase them, so you can be able to have an idea of what you're consuming every single day. It is very, very important. It is very, very important. So now let's talk about the realities in Nigeria that we tend to face. There are things that we struggle with, especially when it comes to dealing or managing breast cancer, for example, that a lot of women dealt with. The person I told you I spoke with last year, one of the challenges that she had was the fact that the cost of running this test and even doing the chemotherapy and even visiting the hospital, even seeing the specialist, was a lot for her. She had spent millions of naira. If you imagine spending millions of naira to manage breast cancer and you're still not getting better. She has spent millions of naira. She had taken out loans to actually go through those chemotherapy and radiation therapy, but she still was not getting better. She has spent lots of money doing the first surgery, but she still was not getting better. Why? She had to even need a private hospital because of the challenges she faced during that time. I think during that time, the doctors were on strike in the government hospitals that she was visiting. So those are some of the challenges that we tend to face. The challenge, especially in Nigeria, either government factor, human factor, and so on and so forth. So that's the challenge that she had to face. There were limited screening centers. But another challenge she had was there was not enough awareness of the possibility or the importance of getting tested on time. So that's the reason why we're talking about this now. Like, you have to actually get tested on time. We didn't talk about it. People don't tend to talk about the importance of doing breast examination, because she said she didn't even know, or she didn't even understand what self-breast examination was. Because when she was diagnosed with breast cancer, she knew what self-breast examination was. That was one. And also how expensive it was for her to be able to manage the condition. One of the things that helped her, which I would say I'm grateful for at the moment that we have in Nigeria, that a lot of people are not aware, which I'm going to be creating more awareness for, is she was able to contact some foundation, those breast cancer awareness foundation, that were able to help her take care of most of the treatment she was receiving. But she found them late, as in later on when she had spent some money. But they were able to continue taking care of her, taking care of the paying for her medical bills and also paying for every single thing that she needed while she was being managed for that particular care. So that's one of the things that I would say I'm grateful for at the moment, because we have some breast cancer foundation that I actually do support that help women now to be able to, they help them with the testing, they pay for the testing, for the treatment, for the surgeries. They even raise awareness now for this particular situation and problems. And they help these women especially to be able to deal with this financial burden, because it is a financial burden. I know a lot of women that spend millions on it for it. So if you know someone that is dealing with breast cancer, for example, I would advise you to do your research on some of this breast cancer foundation. I will maybe share some of these foundations on the post after this live, so we can share that with people and create awareness for these foundations to either be sponsored and help, because they really do so much. I know a lot of people that they've actually helped when it comes to managing breast cancer. So moving on, one of the things that we also need to talk about, which I have mentioned, is the testing. When is the best time to actually get tested? For example, aside from self-breast examination, which you're supposed to do earlier on, but if you notice any lump, one of the first tests you should do is a breast scan. It's important to have a breast scan done, especially if you notice or detect a lump on your breast. It's important to have breast scan done. And most time, once you are from 20 years and above, or even when you've started seeing your period, actually, as a woman, you've attained menarche, you started seeing your period, and you notice any form of lump or discharge from your breast, it's important to have a breast scan done, so you have an idea of what is actually going on. So another thing that people do is external biopsy. That's what I had done. I had an external biopsy done to remove the lump, actually, because I think at one point it was either growing in size, so I needed to get it out. So it's important to, if you have lump at the moment, better to try and do the external biopsy to get it out and get it tested to ensure that it's not a cancerous lump or mass or cell that is growing in your breast. So for the later test that you can do, which is a routine test that a lot of women do from the age of 35 and above, is the mammogram. So mammogram is one test I tell women to do maybe once in 2 years. Why? Because of the amount of radiation. So, but self-breast examination is one of the most important tests to actually get done, to actually do. And it will really save you a lot of time, and it's one of the good screening for early detection. It will be good screening for early detection. So another thing that you also have to do is create more awareness about breast cancer. Breast cancer is not a death sentence. Like I said in the beginning, once it's detected early, it is easily treated. You can easily do it through surgeries. You can easily do it through either change of lifestyle. Like I gave an example of the woman I met last year, and that really helped to really shrink the mast cells because chemotherapy wasn't working. There's some people that chemotherapy would have helped, but because of the side effect of chemotherapy or radiation therapy, some people are not able to take on that side effect, or it tends to affect them a lot that they have to discontinue it. So it's important to change your lifestyle, especially what you consume. So it's better to start changing it now, not later. That's the idea of this awareness that we are creating, that we create every single year, is to work on our lifestyle, do lifestyle change. If you are on the big side, try to start losing weight now. Go on diet. There are different types of diets you can go on. Start exercising, so get proper blood circulation. Your lifestyle is also very, very important. Lifestyle tends to also affect even your health condition. If you are treating something, for example, and you are not taking care of yourself, you're not even going to get better. You're going to be wasting your time. So lifestyle, like if you consume a lot of alcohol, try and cut down on it, or even stop it if possible. If you smoke, try as much as possible to start withdrawing gradually from smoking, because those things are things that tend to affect the health in general. So that would actually help a lot. And then bring your weight to an ideal weight where, especially if you're a woman and you are not yet you've not yet started having children and you are interested in having children. Those are 30 things to consider, because when you consider these factors and put them in place, because even this issues with our breasts even tends to affect fertility. For example, if you're producing excessive milk, for example, and you are not pregnant, you've never given birth before, that's an indicator for breast cancer, for example, and even an indicator for other fertility issues. So it's important to be aware of yourself, be aware of your health, take charge of your health, and ensure that you put in the necessary things in place to ensure that you live healthy for your loved ones, you live healthy for yourself, you live healthy for your family, and life is good. Life is amazing. Thank you. If you have any questions, you can drop your questions. But I really appreciate as many of us that joined the live session today. Thank you so much for watching Dr. Red Diaries. Thank you for subscribing, for commenting, for sharing. I really appreciate us so much. And I'll see you on my next episode. Bye.